Assalamualaikum and good day to Dr. Shazwani and to our fellow classmates. Today, we are going to present our case study regarding
gastroesophageal
reflux
disease. Before that, let us introduce ourselves. Hi, my name is Mashita.
Hi, my name is Najwa.
Hello, my name is Afiq.
Hi, my name is Aisha.
This is our table of contents.
The objectives of this case study are to describe the effects of Gerd, to explain the factors that increase the risks of Gerd, and lastly, to elaborate on lifestyle changes that can minimize the risk of contracting Gerd.
Introduction of Gerd. What is Gerd? WebMD editorial contributor define that Gerd is digestive disorder that affect the ring of muscle between your esophagus and your stomach. The ring is called the lower esophageal sphincter. Second point is how can Gerd happen? Dr. Kanandi stated that Gerd occur when the esophageal sphincter does not close correctly, causing the content of the stomach to leak back into the food pipe. When stomach acid enter the esophagus, it causes inflammation and burning sensation. When the condition becomes serious, it is called Gerd. Next is the symptom of Gerd. According to Mayo Clinic, the common sign of Gerd is burning sensation in your chest, or commonly known as heartburn, usually after eating, which might be worse at night or while lying down. Backwash, or commonly known as regurgitation of food or sour liquid. Upper abdominal or chest pain, trouble swallowing, and sensation of a lump in your throat.
Hello, my name is Najwa Afifa and I'm going to present about effects of Gerd. This is the picture of esophagitis and esophageal stricture. What is the effects of Gerd? Firstly, inflammation of the tissue in the esophagus, esophagitis. A condition characterized by painful and challenging swallowing can result from stomach acid damage to esophagus tissue, causing soreness, bleeding, and ulcers. Secondly, narrowing of the esophagus, esophageal stricture. Scar tissue forms due to stomach acid damage to the lower esophagus, narrowing the food channel and causing swallowing difficulties. This is the picture of barred esophagus and heartburn. Thirdly, precancerous changes to the esophagus. Acid damage can cause changes in lower esophagus tissue, increasing the risk of esophageal cancer. Heartburn. Gerd is a common condition characterized by chest burning and vomiting of bitter or sour liquid into the mouth or throat. This is the common effects of Gerd. Firstly, regurgitation, release of stomach acid of food into the mouth, causing a sour or bitter taste. Secondly, chest pain, resembling heart attack symptoms, typically locate behind the breastbone. Thirdly, asthma and respiratory issues. New or worsening asthma, acid reflux can irritate airways and trigger bronchospasms. Fourthly, chronic cough. The backflow of stomach acid into the throat can cause airway irritation. Other than that, hoarseness and throat problems. Repeated exposure to stomach acid can cause hoarseness and throat problems. Lastly, dysphagia. Dysphagia means trouble swallowing.
Hello, this is Afiq and I'm going to talk about the factors that cause Gerd. The first factor is weak lower esophageal sphincter or LES. When the LES becomes weakened or relaxes inappropriately, this allows the stomach acid to flow back up to the esophagus. As a consequence, the stomach acid will irritate the delicate lining of the esophagus. This will lead to symptoms like heartburn, regurgitation, chest pain, and difficulty to swallow. Second, hiatal hernia. It is a condition where the upper part of the stomach bulges through the diaphragm, which allows the stomach acid to flow back to the esophagus. This condition can weaken the LES and subsequently will cause GERD. Third, the overproduction of stomach acid. This happens due to environmental factors such as stress and anxiety. The excessive production of stomach acid will overwhelm the protective mechanisms of the esophagus, which cause irritation and reflux. Fourth is the gastroparesis, which is the delayed gastric emptying disorder. When this happens, the stomach will take longer than usual to empty its contents, which is food. It will increase the chance of acid reflux to happen. And the fifth factor is the increasing age. As our age increases, the risk of contracting GERD is getting higher. Not only that, there are also other risk factors that can cause GERD, such as smoking, taking certain medications such as aspirin, eating large meals or eating late at night, drinking certain beverages such as alcohol or coffee, and eating certain foods such as fatty or fried foods that can increase the risk of GERD.
Hi, my name is Aisha and I'm going to present about lifestyle changes that can minimize the risk of gastroesophageal reflux disease, or known as GERD. There are 4 lifestyle changes that can help to minimize the risk of GERD. Firstly, it is advisable to maintain a healthy diet by avoiding trigger food such as spicy and acidic food, caffeine, chocolate, and high-fat meals. Additionally, eating smaller, more frequent meals can help to prevent overeating, which is known to contribute to acid reflux. Next, avoid lying down right after eating. Wait at least 2 to 3 hours before bedtime. Waiting a few hours before lying down after a meal allows gravity to work in your favor and keep acid reflux in check. Elevate the head of your bed or use a ridge pillow to keep your upper body raised while sleeping. It can help to prevent stomach acid from falling into the esophagus at night. Next, maintaining a healthy weight or losing extra pounds if you're overweight is essential to reduce the risk of GERD. When you have excess belly fat, it preys on your stomach, which can lead to GERD symptoms. Obesity is the main cause of GERD because of the extra stomach fat forces stomach acid into your esophagus. So, it is a good idea to work on your weight to prevent or manage GERD. Lastly, to prevent GERD, it is important to avoid triggers like alcohol and smoking. These habits can relax the lower esophageal sphincters, allowing stomach acid to flow back into the esophagus. Smoking can also reduce the amount of saliva in your mouth, which helps neutralize the acid. Quitting smoking is known to reduce the severity of acid reflux and GERD.
To conclude, gastroesophageal reflux disease, or GERD, is a common digestive disorder that is suffered by 783.95 million worldwide as of 2019. This case study have identified the symptoms of GERD, the effect of GERDs, the factors that causes GERD, and the ways to minimize the risk of contracting GERD. We as students in science should advocate the public regarding the effects of GERD, help implement the lifestyle changes to reduce the risk of GERD, and to introduce GERD to new people who have symptoms to be further examined by medical professionals.
Thank you for watching.